Hello, welcome back to my channel RB MCQ Bank Knowledge Booster. Today I am going to discuss about MCQ for Staff Nurse Exams Preparation. So let's test the first question. The question is that which position is involved while conducting normal delivery? Here options are option A supine position, option B follower's position, option C Trendelenburg position, option D lithotomy position. So here the correct option is option D, that is lithotomy position. So lithotomy position is given while conducting normal delivery. Next question number 2. Which position is involved while doing the procedure of female catheterization? Here options are option A supine position, option B semi-polar position, option C sitting position, option D dorsal recumbent position. So here the correct option is option D, that is dorsal recumbent position. Here in the figure you can see the dorsal recumbent position. Next question number 3. The question is which lymphatic organ is responsible for filtering blood and recycling red blood cells? Here options are option A liver, option B lymph node, option C spleen, option D thymus. So here the correct option is option C, that is spleen. Spleen is the lymphatic organ which is responsible for filtering blood and recycling red blood cells. Next question number 4. The question is what is the thickest layer of the heart? Here options are option A pericardium, option B endocardium, option C myocardium, option D none of these. So here the correct option is option C, that is myocardium. Myocardium is the thickest layer of the heart. Next question number 5. The question is what is the thickest layer of the uterus? Here options are option A endometrium, option B myometrium, option C perimetrium, option D pericardium. So here the correct option is option B, that is myometrium. Next question number 6. Which one of the following is the commonest site for implantation of ectopic pregnancy? Here options are option A ovary, option B ampulla, option C isthmus, option D interstitial. So here the correct option is option B, that is ampulla. Here on the diagram you can see the ampulla, the part of fallopian tube which is the commonest site of implantation of ectopic pregnancy. Next question number 7. Increase in WBC count is the indications of. Here options are option A infections, option B inflammation, option C immune system disorder, option D all of these. So here the correct option is option D all of these. So increase in WBC means white blood cell count, is the indication of infections, inflammations and also immune system disorders. Next question number 8. The question is a normal WBC count is typically between. Here options are option A 7,000 and 10,000 per microliter, option B 6,000 and 10,000 per microliter, option C 5,000 and 11,000 per microliter, option D 4,000 and 11,000 per microliter. So here the correct option is option D, that is 4,000 and 11,000 per microliter. Next question number 9. The question is red blood cells are also known as. Here options are option A erythrocytes, option B leukocytes, option C granulocytes, option D lymphocytes. So here the correct option is option A, that is erythrocytes. Erythrocytes is also known as the red blood cells. Next question number 10. The question is which one of the following nutrient is crucial for the formation of red blood cells? Here options are option A iron, option B calcium, option C potassium, option D magnesium. So here the correct option is option A, that is iron. Iron is the nutrient which is crucial for the formation of red blood cells. Next question number 11. The question is which one of the following condition is characterized by narrowing of urethra? So here options are option A urethritis, option B urethral stricture, option C nephritis, option D cystitis. So here the correct option is option B, that is urethral stricture. Next question number 12. The question is the common site for checking the pulse in an emergency is. Here options are option A femoral artery, option B brachial artery, option C radial artery, option D carotid artery. So here the correct option is option D, that is carotid artery. This is the common site for checking the pulse during emergency. Here on the diagram you can see how to check carotid pulse, where and how to check. Okay, when feeling for the carotid pulse under the angle of the jaw, use very light pressure. You have seen on the diagram where and how to check the carotid pulse. See the figure properly, then you will know where to check the femoral artery pulse. Okay, how to check? We have to check by pressing deeply below the inguinal ligament and about midway between symphysis pubis and anterior superior iliac spine. Okay, see the figure closely. And this figure is showing where to check the brachial pulse. Brachial artery is located on the inner side of the upper arm, just above the elbow crease or antecubital fossa. That's why we have to check the brachial pulse in this location. And this one figure is where and how to check radial pulse. To check the radial pulse, you have to place the index and middle fingers at the base of the thumb and slide down about 2 cm in the groove in the wrist, pressing slightly. We have to press very slightly, okay? Then only we will able to feel the radial pulse. Next question number 13. The question is, which one of the following is used as an anticoagulant in blood transfusion? Here options are option A, potassium chloride, option B, glucose, option C, sodium bicarbonate, option D, heparin. So here the correct option is option D, that is heparin. Heparin is used as an anticoagulant while giving blood transfusion. Next question number 14. The question is, the instrument used to measure the body temperature of the human beings is known as. Here options are option A, thermometer, option B, clinical thermometer, option C, hydrometer, option D, digital thermometer. So here the correct option is option B, that is clinical thermometer. Okay. Next question number 15. The question is, what is the most common cause of heart attack? Here options are option A, arteriosclerosis, option B, hypertension, option C, cholesterol, option D, diabetes. So here the correct option is option B, that is hypertension. Hypertension is the most common cause of heart attack. Next question number 16. The question is, oliguria refers if the urine output is. Here options are option A, 400 ml per day, option B, below 400 ml per day, option C, 100 ml per day, option D, none of these. So here the correct option is option B, that is below 400 ml per day. Okay, if it is below 100 ml per day, then it is known as anuria. Next question number 17. The question is, which one of the following represents the end stage of kidney failure? Here options are option A, renal impairment, option B, renal insufficiency, option C, renal failure, option D, uremia. So here the correct option is option D, that is uremia. And this uremia, it is also known as end stage renal disease, in short ESRD. Here high levels of nitrogenous waste accumulate in the blood, and there are a multitude of clinical manifestations. Ultimately, the uric acid and other waste precipitate on the skin, producing uremic frost, coma, and death follow. Next question number 18. The question is, which one of the following are the risk factors of renal carcinoma? Here options are option A, tobacco use, option B, obesity, option C, dialysis, option D, all of these. So here the correct option is option D, that is all of these. All these, tobacco use, obesity and dialysis, these are the risk factors of renal carcinoma, that is renal cancer. Next question number 19. The question is, when the body temperature rises more than 38 degrees Celsius continuously for more than 24 hours or intermittently for more than 24 hours in any 72 hours or intermittently for more than 24 hours in any 72-hour period is known as. Here options are option A, hyperpyrexia, option B, pyrexia, option C, fever, option D, cold flu. So here the correct option is option B, that is pyrexia. Next question number 20. The question is asthma may be, here options are option A extrinsic, option B intrinsic, option C both A and B, option D none of these. So here the correct option is option C, that is both A and B. Asthma may be extrinsic, that is allergic asthma may be there, and intrinsic, that means non-allergic. Asthma may be allergic and non-allergic. So here both answer is correct, that is answer C. Next question number 21. The question is in asthma blood investigation shows increase in, here options are option A eosinophilia, option B basophils, option C neutrophils, option D none of these. So here the correct option is option A, that is eosinophilia. Eosinophilia increases in asthma. Thank you for watching and keep watching to get update of the new videos.